and today is 28th December 2025. Our meeting is live in Google Meet, YouTube, and Facebook as well. Before proceeding, we would like to start with the opening prayer. So I would like to welcome the one who is who will lead us into the opening prayer so that we can proceed with our meeting. I would like to welcome Miss Mercy Cooper, so she can lead us into the opening prayer. Miss Mercy, you're warmly welcome.
Thank you. Let us bow. Heavenly Father, we humbly come before you tonight, this evening. We've had full of gratitude for the privilege of gathering tonight together. We ask for your divine presence to be with us as we engage in discussions on matters of importance. Grant us the wisdom to listen to one another with your open hearts, seeking to understand the perspectives of difference from our own. May your word be filled with kindness and respect. Reflect your love and grace upon every one of us. Through your Lord Jesus Christ, we pray in Jesus' name. We pray. Amen.
Amen. Thank you so much, Miss Mercy Cooper, for the powerful prayer. Again, who we would like to welcome everyone who have already joined and are still joining to this Dr. Elvis Oncology Talk. And um, our meetings are live in Facebook, YouTube, and Google Meet. We appreciate everyone who are sharing the links so that we can have more, we can reach more people um, and be able to learn together. So we appreciate everyone who are sharing the links um, for them to join. And our meetings are usually on the last Sunday of every month. So the last Sunday of every month, we're usually conducting these virtual cancer awareness meetings live on Google Meet, Facebook, and YouTube. Um, Before we proceed further, on behalf of the Dr. Elvis Oncology Talk team, um, it is our pleasure to welcome Mr. Malaysia Jimmy, who is the program manager. Mr. Malaysia is our program manager, and uh, usually usually he usually conducts things back and in the background so as to make the meetings be able to be successful by every Sunday, the last Sunday of every month. We appreciate his hard work and his time in order to make the meetings successful. Um, Let me welcome Mr. Malaysia to greet us uh, and be able to say anything. Mr. Malaysia, you're warmly welcome.
All right, so let me say thank you so much for the recognition. I'd like to use this time to welcome each and everyone. Joining us from wherever you are when it comes to Dr. Alex Oncology Awareness. And today marks the last in a year of 2025. That is the eighth virtual cancer awareness under the theme HIV and AIDS and cancer links. So we like to use this time to say thank you for joining us. We ask that this meeting will be interactive. So it is meant to actually bring out some hidden things that we don't know about, most especially when it comes to a very common and a well-known disease that we all talk about on a daily basis, HIV or AIDS. So it is my ardent hope that we make it more participatory, we make it more interactive, that at the end of the day, we will have the broad knowledge that we all wish to acquire. Again, I'd like to say welcome. Feel pleased to express yourself. Thank you.
Okay, thank you so much, Program Manager, Mr. Malaysia, for for the welcome greeting and for greeting us. Okay, so without wasting time, I would like to move forward to um, introducing our main speaker today, who is going to lead us into the today's topic, which is the relationship, understanding the critical link between HIV, AIDS, and cancer disease. So, our today topic speaker is Dr. Elvis J. Davis. Dr. Elvis J. Davis um, is a Bachelor of Science in Biology holder. Studied in the University of Liberia, but also he's a medical doctor. He's a medical degree doctor from the College of J. Dozen um, College in Liberia. Sorry, it's from the A.M. Dogliot College of Medicine in Liberia, but also is a master's in medicine candidate, clinical oncology candidate from the University of Muhimbili here in Tanzania. But also on top of that, Dr. Elvis J. Davis is an educator, and also he's a research fellow, and also he's the International Atomic Energy Agency fellow, and he's now working as a clinical oncology resident in the Ocean Road Cancer Institute in Tanzania. Dr. Elvis J. Davis is going to lead us into the today's topic, which is the understanding the critical link between HIV, AIDS, and cancer disease. Mr. Dr. Elvis J. Davis, we are warmly welcome you so that you can lead us into the today's topic. You are warmly welcome.
All right. Thank you so much for welcoming me. And of
And
course,
of
it's a
course, it's
pleasure
a
to be
pleasure
back
to be
after
back
being
after being
sitting
sitting
on
on
the
the
fence for
fence
a
for a
month,
couple of months,
inviting
inviting
fellow
fellow
colleagues
colleagues
who
who
have
have
been
been
able
able
to
to
contribute
contribute
over
over
the
the
past
past
period
period
of
of
month.
month.
It's good to be
It's
here
good to be
again
here
to
again
speak
to
to
speak to
our
our
participants
participants
with regards
with
to
regards to
one of the
one of
most
the most
critical
critical
topics or
topics
diseases that
or
we have
diseases that we
affecting
have affecting
us
us
globally.
globally.
And of course,
And of course,
tonight, as
tonight,
the
as
moderator have
the
said,
moderator have said,
be
be
we're gonna be
we're gonna be
looking through
looking
our
through our discussion that focuses on
HIV, AIDS,
HIV,
and
AIDS,
its
and
cancer
its
links.
cancer links.
So I think I'll need to use this other computer, and it's gonna give a problem when I'm presenting because for those who would like to join, it's gonna be for those who would like to join, it's gonna be a problem because I have to use this other computer. I thought I would have used this, but there's a little technical issue, so I have to use this one for the presentation. So I'll just share my screen. Do we see the presentation? Can everyone see the presentation?
Yeah.
Yeah, sure.
Yes, yes.
Yes,
All
sir.
right,
Yes,
all
we
right.
see
Thank
the
you so much.
presentation.
Yeah, we are seeing the presentation.
Okay. So thank you again once more for having me tonight. As our moderator have said from the introduction, um, we're going to be discussing, this is our topic, and this is very cardinal for us to complete the year with this one because um, this is a global thing. It has been dwelling among us for a long period of time. And with our practice here as a oncologist in training, we have seen a lot of individuals who are people of population living with this condition and who usually come down with associated cancers. So we thought it was that it is prudent enough since we are discussing, let's try to also be able to look at some risk factors, some things that can be able to lead to this condition being developed in people living globally. So we'll continue from here. This is our outline. Over the next few minutes, we'll look at a brief introduction to HIV and AIDS. We're going to look at epidemiology, the risk factors for transmission. We're going to be looking at method of prevention and so forth. And as we see, just how we're going to follow. Sorry, I might not be able to confirm people tonight, so maybe you can just post in the chat room for those who are part of the chat room. Let them go to Facebook or YouTube to follow us because now I'm presenting it's difficult for me to confirm people. That's why I try to use another computer. I used to be able to use a two computer to be um, meeting people on this one, but it's difficult. So for the introduction, there are two key things we need to look at. Usually we hear HIV and then sometimes we hear AIDS, but these are two different things that we need to understand tonight before we go forward. Firstly, HIV, it is the virus, and it is called it is a short form for the long name immunodeficiency virus. And of course, it is a virus that attack the immune system of human, and it targets types of cells that are called the CD4 cells. Is a type of T cells, and then these cells are the cells that usually function in the immunity of humans that fight against infection, infestation, and things like that. So the HIV, that virus attacks these specific cells. Now the next thing we need to look at is ACE. ACE is a short form for the long word or the long name acquired immunodeficiency syndrome. And then it is now the more advanced stage of the HIV infection. That is, it has progressed through the various stages, ranging from stage 1, 2, 3, up to 4. And that point now, it is now referred to as, as AIDS. So as we see there, during that time, you will understand that there will be occurrences of these of conditions that when you as a normal human being, you are existing, you don't have the HIV infection, you do not come down with them. And this type of infection or diseases, we refer to them as opportunistic infections. Can somebody turn off their mic, please? It is giving us a feedback. Now for the epidemiology, can somebody turn off their mic, please?
Harris, please tell them, Harris, please tell them.
HIV or AIDS actually it remains a major global public health issues. That is, it is worldwide, and you have millions of people being affected worldwide. So now, according to the World Health Organization, you see that there were about 38 million people that were living with HIV in the year 2023. About 38 million people that were living with HIV in the year 2023. This is a record from the WHO, the World Health Organization. Now, to continue with why the cancer links with HIV matters. First, let us take a look at this basic information. So, in sub-Saharan Africa, it carries the highest burden of the HIV and AIDS occurrence. Even though it occur in all regions of the world, but mainly in sub-Saharan Africa, from the Tanzanian range going downward, all these countries that are in the main countries.
I'm say on you have done your
You
Harris,
say that. Can you please mute Harris? Will I get it?
you have too much.
I
Because
cannot do except I stop
okay.
the presentation. That's the only way. But Harris should be fully aware that we have rules that we should not turn on our mic. If you disturb us tonight, that means you don't want to join. Harris, can you please turn on your mic or you disconnect? All right, so I will break in for a while and turn him off. You just give me a few minutes and I will turn him off here. Harris, can you turn on your mic? Why are you disturbing us this night? And it's kind of interfering with the time we have.
Just join me. I'm just listening to lesson. So I don't have much on that.
I have turned him off already. Don't touch your mic again, please, Harris. This is a problem for us. Do we see him on screen still?
Yes, we see your screen.
Yeah, we can still see it.
Okay. All right. So, like I was saying, in sub-Saharan Africa, that's the main area you have a higher burden of the HIV and AIDS occurrence, even though it occurs in all regions. But the truth is that um, people living with HIV, they have higher rates of developing certain types of cancer condition, and it is due to mainly the immunosuppression. Now, but the truth is that there has been over time there have been advances in the development of the antiretroviral therapy, which we call the ART, and because of the advancement in this treatment modality, it has led to a drastic or a significant reduction in the occurrence or the death related to this condition, even though there's still a challenge with regards to stigma in our communities, because when people recognize you as a person living with HIV, they tend to, stigmatize you, see you as somebody awkward and things like that. That's still another challenge. And another challenge also, which of course we are discussing this for tonight, is as a result of the occurrence of the associated cancers. And we're going to see ahead why it happens. So some of the cancers I consider, because we divide them into two categories. So cancers that are linked to HIV, they are divided into two categories. Those that are considered as the AIDS-defining cancers. For instance, we have the Kaposi sarcoma, we have the non-Hodgkin lymphoma, and that of the cervical cancer. And then those that are non-AIDS defining, so they have the AIDS defining, that these are the ones I spoke about, and then we have the non-AIDS defining, which are the lung cancer, the liver cancer, and anal cancer. So now, when do we tend to say, or why did the division of AIDS defining and non-AIDS defining came about? You know, from the outset or the onset of this, the epidemic of HIV infection, there were studies that were done globally among people that have had this infection. And then they noted that from the very initial state, patients that they did studies for, usually, you know, they do the viral load and do the CD4 counts. So patients that had high viral load and low CD4 counts, most of these people had the occurrence of these cancers like the Kaposi sarcoma, like the non-Hodgkin lymphoma. It includes the bucket lymphoma, the diffuse large cells lymphoma, the primary central nervous system lymphoma. These are the ones that are considered under the non-Hodgkin lymphoma. And then also cervical cancer. So these cancers, from the onset of the epidemic of HIV, these are cancers that when a person has had increased progression in the existence of the HIV infection, usually the cancers that occur among them were these ones. So because of that, they refer to them as the AIDS-defining cancer. So it was served as a marker for, an excessive immunosuppression. It served as a marker for an excessive immunosuppression. Now for the non-AIDS defining, like the lung cancer, the liver cancer, it only tells us that usually people with HIV, this cancer will exist among them more commonly than the general population. But the reason it becomes non-AIDS defined is because even if the person CD4 count is high, like above even 500 cells, or above 200 cells, above 300 cells, like that, CD4 counts, the CD4 cells, if it is above that and the person is on the ART well, these cancers tend to still be prevalent among these people. So because of that, since the cancer is occurring not as a result of immunosuppression, but as a result of other underlying conditions, but it is more occurring in people that have HIV than the general population. That means those who don't have it, it becomes non-AIDS defining. So we get that concept. It is existing in these people more commonly than people who don't have HIV. But even if the person CD4 counts and the viral loads are being controlled, still this condition can occur, making them not to be serving as a marker for significant immunosuppression. So now, why are we studying this? Why are we discussing this? Because understanding the links between HIV infection and that of the occurrence of cancer and that of early detection is crucial. It is actually crucial for early detection. It helps to either prevent or to improve the outcomes of the treatment that we offer in the facilities. We continue with the epidemiology. Now, if you take a look at this point here, as you see my pointer here, we see here this red. This is for high region. First, this is the prevalence, HIV prevalence worldwide. So look at the worldwide distribution of the occurrence of HIV. Now, if you see red, those you see red are the ones that have high prevalence, and those you see in blue are the one with low prevalence. Now take a look at it. You see here, like somewhere in North America, somewhere around here, you see this blue here and around this point. So these ones are the area of low prevalence of HIV. But now come and see around here, like cutting a little bit from around the region of somewhere around Liberia, crossing all the way across here, coming down to this end and coming down to South Africa and even Madagascar. They have high prevalence of HIV infection. So these ones, it shows us the global prevalence. Now we come to the right. In people living with HIV, you get to see that women and girls make up a majority, a proportion or percentage of these people, followed by men and boys. If you combine both men and boys, is the next. But taking men alone, they have a less percentage. And this for women, it explains the biology of the female system. As we'll go ahead later on, you get to understand. We'll look at the method of transmission, you get to understand. But to just throw a bit of light on it, you know, the HIV, the virus usually goes through the mucosal membrane like that. If it is not by a means of either pricking by sharp objects or by blood transfusion, if it is as a means of maybe sexual intercourse, compare with males to female, female have more larger surface area for the mucosa membrane as compared to female. I mean to male. So because of that, it puts them at a higher risk because the semen carry a larger amount. If the male is infected, the semen carry a larger amount of the virus. So when it is deposited, you know there's a huge um, mucosa space or surface area, because as a result of that, female are at a higher risk of, you know, getting coming down with the disease as compared to men. Now, you look down here to the left, we look at increased cancer rates with HIV. So you see here, for Kaposi sarcoma is very high. Most commonly, most of the time, if a person is having HIV, and the virus, I mean the virus load is not controlled and the CD4 count is not well managed, like above 200 cells. What happened here is that most of the time, these are the cancers that occur, and we see majority of them, you know. So this is the most common, and you see as we go down, it is reducing gradually. So cervical cancer, most often you will also see it. Another cancer you also see it, and that of Kaposi sarcoma. Now we come here. Now for this, you see the red line and the blue lines. Initially, from the year 2000, there was high increase of the HIV infection and also a high incidence of death occurring. But as time went by, the development of the antiretroviral therapy came in. What happened now is that the incidence and that of the related death has started to reduce up to the year 2024. This is what has been explained here. Now we come to the method of transmission of HIV. These are various methods by which HIV can be transmitted. It is not strange to us. There are lots of people that are studying across HIV specialists, their infectious disease specialists have talked about it. But we're going to throw a little light on it since we are linking it with cancers. Now, do you see this first? Usually unprotected sex. Unprotected sex, either being vagina or anal sex, is one of the risk factors. That's one of the means by which a person will get this virus. So another means here will come down here to the left, behavioral factors. For instance, now here you have multiple sexual partners. Somebody with multiple sexual partners, you are putting yourself at a higher risk of contracting the HIV infection. Sorry, I have a call coming. And the next thing is that somebody people who are drugs addicts having substance abuse, they usually also are higher rates of developing or coming down with HIV infection. And then somebody who usually have sex without the use of condom, you're also putting yourself at risk because you might not know the status of the individual. Now, another one here is mother to child transmission. Now, the mother to child transmission occurs, at three levels. It can be the uh, the intrauterine stage. It can occur during the intrapartum and then postpartum. That is intrauterine. That means uh, the child is still in the uterus of the mother, and then um, the virus load or the CD4 count is not well managed. As a result of that, these viruses can cross the placenta and then infect the baby. Then the next level is at the level of delivery. Maybe during delivery, the mother blood gets in contact with the child's blood. At that point, the child gets infected with the HIV virus. And then also postpartum, it could be during breastfeeding. You can also the child can also come down with that if the mother CD4 counts and the virus low are not controlled appropriately. So another way, some biological factors that can increase the rates of HIV transmission is having a very high viral load, and you having other HIV, let's say STIs, and then a person of male who was not circumcised. It also because the purpose around the head, the crown of the penis will serve as a means by which you can be able to keep the virus when you happen to have sex with a female who is infected, and then it keeps there. It can find a way into the mucosa membrane, and then through the into the bloodstream and start to multiply. And then also it has social determinant, poverty, lack of healthcare services, and things like that. And then stigma can also play a major role in the transmission of this virus. Now, how do we prevent? You see here, this is a shield. As you know, those who go to the war front, this is a shield. It serves as a means of protection, especially for olden days warriors, because this one, if the arrow is being shot at you, this one you can use to block this one. So the defense by which you can be able to help is by one, by using condom when you are having sex with a person who you don't know their status, or you can be the best and most appropriate method is by abstaining from sex, and or if you cannot, you should have a very few partner. Either you use condom, you stay away from sex, or you have just one partner who you trust, and that partner also have just only you, because it cannot be you alone. It has to be both persons. Then the next one is to avoid exchange of needle, because I mean these are practices that are improving our hospitals over the period of time. So these ones I know they usually might not, they will rarely occur. Now another one, these three we see here, the PERP, the PEP, and the ART. So this one almost like prophylaxis, the pre-exposure. That means you take it before maybe having something to do with somebody who you don't trust the status, or this one, the PEP, the post-exposure. You use this one if you have had sex with a person who you did not trust their HIV status, and or this one, the person is already infected. You can be able to use this one to avoid transmission to others, and then you can prevent at the level of childbirth. Also, when the female is pregnant and after birth, you can also be able to control at that point to prevent the transmission. Now we come to look at how the virus, the disease progressed from one point to the next. It occurs in stages, and the WHO have staged this usually from stage 1, stage 2, stage 3, and stage 4. And at each of those points, you're going to see that from stage 1, usually you just have lymph nodes. We say lymph adenopathy, and usually it is generalized. And one thing, uh, if you are considering, lymph adenopathy, there are certain places you don't want to consider as lymph adenopathy because these are common areas. Even if you have a trauma, maybe in the abdominal area, or maybe you have some infection like that, it tends to drain in these lymph nodes, especially the inguinal lymph nodes. These places you don't consider them, but like for instance, you see these lymph nodes here, and for a bit of clarity, the lymph nodes are a specific type of structures that form part of the lymphatic system for those into medical sciences and into sciences. These are structures that are part of the lymphatic system. The lymphatic system tends to drain fluid and then recycle them. So the lymph nodes are special structures that function in immunity and other roles. So now these lymph nodes will be inflamed or they will be large in the very initial stage, that is stage 1. Now, when you go to stage 2, this is when now varieties of things start to set in. You will now start to see that the person will start to lose weight when they did not intend to lose weight. They will start to have recurrent infections. You treat the infection, after a while it comes back, and then somebody will say, oh, the chronic cold and things like that. You start to have oral ulceration and things, as you can see here at this point. You have some other lesions that you really did not expect to see. Now when you move to stage 3 now, you start to see that the person start to lose weight severely. At this point, it's just, a low around 5%, and a low above that of their weight is they are being lost. But around this point, like between 10% or more, they tend to lose that one, their weight. And then also you see the person is having diarrhea, like take all these means by which you can better prevent the anti-diarrhea medication, still it cannot stop. And you also see the person having oral thrush or oral candidiasis, and also with occurrence of pulmonary tuberculosis. Then this is stage 3, sorry. Now to stage 4, this is where our cancers sit. This is why we decided to talk about HIV, because when the person, like for instance, you go to the center, you go for the screening, and then they tell you that, well, the counselor tells you, we did a test, and we see that the test show that it is reactive or is positive. So we want to advise you for you to start your treatment, because if you start your treatment, it can protect you, it can help you to live longer, and you will not be able to spread the disease to others. Some people will say, no, it's not true, it's not possible, it's not true. People will deny, people will even reject, and some people will even maybe accept, but they refuse to start treatment. Now, these people who refuse that are the ones that will go through these stages. People who refuse to take the ARTs are the ones who will go through this, because as you live from this stage to the next one, your CD4 counts are going away, because the virus is not joking with it, it is destroying it. Every moment it is destroying it. So as your CD4 counts reduces, just think about how it is like. All right, you have your country, and then you have your soldiers. Your soldiers, the army is the one that defends the country, and then the other the soldiers are being killed. So anytime you are vulnerable to any other person from any country or anywhere can just enter the country and then either overthrow whoever they're supposed to overthrow, or just deal with anyone they have to deal with. This is what happening. So when the person is not taking ARTs to help reduce the virus load, increase the CD4 count, then they will start to progress through these stages. Now they will come to stage 4, which is signifying a severe HIV infection. And now we come to see the Kaposi sarcoma. Kaposi sarcoma, it will start from the, sometimes you have it on the legs of the person, sometimes it occur on the face. These are the common areas it occurs. Sometimes it will occur on the body, but sometimes on the face, and then sometimes it occur in the lung, and then at times also in the gastrointestinal system. These are the common places they happen. Now also you have the non-Hodgkin lymphoma, like the large diffuse large B-cell lymphoma, like you have the bucket lymphoma, you have the primary central nervous system lymphoma. These are the ones that you will see for this non-Hodgkin lymphoma. Then cervical cancer. Cervical cancer will also the rate at which a person is will develop cervical cancer. It also increases, and we're gonna see how this happen, or maybe in the next slide. Now, cancer in HIV. So initially, from the introduction, we said cancers are divided into, that's the HIV, that's the AIDS-defining cancer, and those that are non-AIDS-defining cancers. Now, the AIDS-defining cancers are the ones. So you see, these are typical representation of how the Kaposi sarcoma occur. But mainly it's on a foot, and then on the face, and then usually it occurs in the lung, and then the gastrointestinal system. Most of, rarely it might have at this point, but the most common areas are the one I'm listing. And this is as a result of infection by the human herpes virus type 8. Now, the explanation is such that when a person comes across this virus, you have an immune system that can be able to contain that virus. So it almost like puts it in a latent phase or in a dormant phase. Now, what happens now is that if the person gets infected with the HIV virus, and then they are now on the ARTs, their virus, their CD4 count drops. What happens? And there will be reactivation of this virus. Now, when there is reactivation of this virus, it will cause damage to the DNA of the person's cells. Now, when that happens, there will be malignant or that kind of cancerous transformation. So when I say malignant, I'm trying to say cancer. So there will be malignant transformation. I mean, it's changing from the normal cell to the cancer type of cell. That's what happens when this happens. So you are normal, you are okay. That's what we say initially. We say opportunistic infection, because it occur by chance that on a normal condition it cannot happen. But when your immune system is diminished, then they find a way now to infect you or to take prominence over your system. That's why we refer to them as opportunistic infection. So that virus now will use that means that your immune system is not strong to cause this DNA damage. And if the DNA is damaged, those who have been attending initially will tell you when the DNA is damaged, it's just like the car has lost its brake, and then you just start running and going. Because when there's, and mind you, will say damage, that means the damage occur and they not repair, or a repair, but the repair was not the appropriate repair. That's when, it tend to lead into the malignant process. So now, these are the areas we're talking about. We see here, the lung is here, the intestinal system is here. These are areas is occur. Then also cervical cancer can be involved. Then in the non-Hodgkin lymphoma, like those ones we talk about, it can have the aggressive type. And for the cervical cancer, we have, I think this HPV, the human papilloma virus, is now a strange name to us. This one also, just as I explained about the human herpes virus type 8, is the same with the human papilloma virus. Mainly the type 16 and type 18 are the most culprit in the occurrence of cervical cancer. So the same way I explained here, the virus might be there. It might be able to have the chance to cause DNA damage. Those the DNA damage will occur. Our body have a means to repair those damages. But because of the reduced immunity, the body cannot be able to arrest those malignant processes, because when the moment the body notices that there is a cancerous, something wrong is going on, what happened? The immunity goes there, the immune system goes there and try to correct it. But in this state now, there will be no means by which you can be able to correct that, because there is no sodium. So there will be no way to correct this one. So as an end result, these damages will persist and then lead into abnormal cell growth and abnormal cell proliferation. And if the cell is supposed to divide at a particular point, and it's supposed to stop at a particular point and not divide, but then the break that's supposed to cause that particular uh, hole or goal to happen is not there, then you see the cells will just be dividing just like that. Now, the next ones are the non-age defining. The non-age findings are, as we said in the introduction, are the one that are more common in HIV population than the general population. But even though their occurrence is not directly or strongly linked with the occurrence of the cancers, I mean of the HIV infection, sorry, or the HIV infection. And now these ones, like you see here, also again the hemopapilloma virus is there, then the hepatitis C virus and hepatitis B virus is there, and then for smoking. So you see that you have colorectal cancer, you have lung cancer. Lung cancer is one of the most common, and as a result of uh, tobacco smoking. You also have liver cancer, which as a result of excessive alcohol consumption. And penile cancer can also be a part, anal cancer, and a Hodgkin lymphoma. You saw we initially had non-Hodgkin was in the AIDS defining, but now in the non-AIDS defining we have Hodgkin. So these are the ones that when they will call, but they are common in HIV population, but they are not very linked to the HIV infection, but they are more common in these populations. So now, why HIV will increase the risk of cancer? Why? Look at the shield we were talking about initially. See, it's broken. So when it's broken, your immune system is reduced, the defense is less. There will be immunosuppression. So because of immunosuppression, when the normal cells incur damage, what happens is that they are unable to, the immune system is unable to recognize, like to carry out surveillance. It is unable to recognize those abnormal changes, arrest them, and take them out of the system. So since the immune system is weak, it is suppressed, it is reduced, it cannot do this function. Those abnormal occurrences will stay, they will persist. Now when it persists, like I explained initially, it goes into malignant transformation. This one you see here, this is fire here. And you see these arrows going almost like it is in circle. This tells us about persistent immune activation or persistent or chronic inflammation. For those who who into the sciences, when we talk about inflammation, usually one of the common signs will be you have pain, and then there will be also heat. Even though there will be all other characteristics, but the two key things we're looking at here will be heat and that of pain. So when you have a persistent inflammatory process occurring repeatedly, and the body immune system is already reduced, and then you having also is reduced, and then it's also being activated. So as a result of this will lead to DNA damage. The counteracting, the immune system is now already active, and then there's a persistent inflammation that occurring. So as an end result, what happens, there could be even free radicals that can develop, and those free radicals can go on to affect, to damage the DNA. And when they happen, the immune system is not there to control this damage, as an end result, it increase the risk of that person developing those the cancers. Then there will be viral co-infection. The person's immune system is already weak, and then initially they were infected with these viruses, but then because they had a good immune system, their body was containing them. So, like for instance, they want the Epstein-Barr virus, mostly associated with the bucket lymphoma and things. So these ones and the human papilloma virus, and that of the herpes, the human herpes virus type 8. When these ones are there, like I explained initially, after the immune system is broken down, this one they will reactivate, and then they cause cancerous changes. And those changes now are the one because our body cannot control due to immunosuppression from HIV, it leads to cancer condition. So now screening and detection, the early detection. So for this is a checklist we develop for the various types of cancer. Like for instance, we have cervical cancer. Usually, you should try as much as possible. You can do a pap smear. They have other ones you can do, like the visual inspection. You can do it. You can do the pap smear and things like that. You can do it for cervical cancer to ensure, and you can also even do the vaccination. I heard about vaccination occurring of program that is in Liberia, and also even in Tanzania, there's a vaccination program that's also ongoing. So this can help to reduce the occurrence of of cervical cancer among people, because if you saw the epidemiology, you saw that women and girls uh, contributed or attributed about 51%. So this is the reason why you see girls are being immunized. And then for the anal cancer, you can also do the anal cytology. Then for the liver cancer, you can do the alpha fetoprotein. You can also do the liver ultrasound. And then for skin, you can do some checks as well. But stigma is a problem because the fear of stigma will make people might stay away from seeking access to healthcare delivery, and as a result of that, they can progress to the advanced stage of uh, of the disease. Now, also, the people are living in an environment where they don't have access to healthcare, and as a result of that, it increases the risks of that. So you should actually ensure that there is access to healthcare for your population. And or if you as a participant of the Dr. Elvis Oncology Talk, we after learning these things, you can make sure that you in your environment that you live, in your community that you live, you can speak to people, not to be ashamed or not to be afraid. They need to go and do checkup, because every time that passes by, like you see this one, as every time that pass by is a problem. Every time that passes is a problem. And late presentation is the worst thing. It's for the entire thing. You see here, this one, the brakes have been destroyed, because if you present late, the treatment is kind of difficult, because somebody coming with Kaposi sarcoma now is just like palliation. We call that palliation in clinical in oncology or say palliation. That means we're just trying to help to improve the quality of life. And then if there's any pain, we reduce the pain. If there is bleeding, we reduce the bleeding. And there is this with that, we just manage it, but it cannot be cured. That's palliation. So that's why late presentation is not advisable. So we need to ensure that we do this checkup, do the screening, like the visual inspection, which is one of the easiest one, but do the specificity and the sensitivity varies. And then also the pap smear as well for ladies. And then also to ensure that you also know your HIV status. When you get infected, you need to start your ART as soon as possible. Now, the key message as we end this discussion this night: HIV can actually increase the rates of certain cancers, and we know them. They are the AIDS finding and the non-age defending. And we know that the age defending are the one that we say they serve as marker for uh, for excessive or significant immunosuppression. And then the non-age defending are the one that even though the person's immune system is regulated or is improved, but still this condition can occur as a result of other traditional factors, the smoking, the alcohol use, or so. But prevention, early detection, that means to get to know that you have that condition early. And then the initiation of ART at a very early stage is very crucial. It helps to prevent progression to the stage 4. So as we attend this awareness tonight, we need to speak, we need to serve as ambassadors in our various communities to try to reduce stigma, try to cause that, to ensure that people do not become stigmatized because they are having certain health conditions. People look at it to be somebody promiscuous, somebody will look at it to be other way around and things like that. But we as the participant of the Dr. Elvis Oncology Talk, need to serve as ambassadors. We need to serve as pioneers out there. Speak to people, tell them that, well, it is like this. This is a natural process because the virus exists. You might not know who you're encountering. Who knows as a whether probably you might even be a barber. You did not go to have unprotected sex. You use condom or you still you have only one partner that you are faithful to, the both of you faithful. But maybe you are barbing and then you mistakenly cut yourself or so, and then maybe the person who have used that, the person is infected. Or maybe you are a health practitioner. You have been treating somebody and by mistake, you prick yourself and that person is infected. And then you become infected. Will you stigmatize a person? Will you say the person is promiscuous? So no, not everyone that will have HIV, it means that they got it from sexual intercourse. As we have seen it, even a young baby can get HIV. So you don't stigmatize people for having HIV. And also, if a person has HIV, if you know these people, try to protect them, their privacy, and then encourage them to take the ARTs. Because if they don't take the ARTs, they will develop cancer. And if you develop cancer, especially at the advanced stage, it becomes difficult to get treated. If it's become difficult to get treated, their lifespan will be reduced. So thank you for listening and thank you for your time. So now we'll turn back to the moderator to continue from here.
Oh, thank you so much, Dr. Elvis Davis. We enjoyed your presentation. It's so inspiring and insightful. Uh, we have been reminded on the importance of do the regular screening for HIV infection, and also the importance of people who are living with HIV to take their medicines accurately so as to prevent themselves from developing various cancers. And so many things we have learned with this presentation. Um, it has been so productive, and we hope to share this presentation to as many people, because we know there are various people out there who don't know that there is a relationship between HIV disease and HIV AIDS and cancer. As some other people are living with living with HIV, they still don't know that if they won't be careful, one day they might develop cancer. So this presentation is so worthy, and I encourage each one of us to be ambassadors for this knowledge, so that we can we can share the knowledge to others, and it can help them in preventing developing the cancers. Uh, thank you so much, everybody, for your participation and being the active listeners. Now, moving forward, we're moving to question and answers session, and would like to welcome everyone who was having a question. There was a hand which was raised, but also anybody who will be having questions should please jot it down in the chat in the chat messages so that we can be able to read the questions and our speaker will be able to answer the questions. So there was a hand which was raised by Mr. Cyrus. Would like to start with your question, Mr. Cyrus. You are warmly welcome.
Just unmute yourself and then you can talk.
Okay. Thank you so much, Dr. Iris, for the presentation. Uh, you kept talking about CD4 count, but I don't really know what you meant by CD4 count and what is the normal value. The next concern has to do with why are people who are just added stand high risks of contacting HIV virus?
Okay. All right. Thank you so much for that. That's a very beautiful question. So CD4 is actually these are specific types of cell, and then they have certain markers on them. We call them the C stand for cluster, and then the D stand for differentiation. So called cluster differentiation 4. These are type of cells that are used mainly in immunity. So the cells are usually there to function to protect against infection and then ensure that also malignant processes would not occur. Now, usually to ensure that a person is not having a risk of transmitting or developing severe infection, you expect that the person's CD4 count should be at least above 200 cells. So when a person is above 200 cells, like that, the person at least you can say yes, it is controlled to a certain point. But you can go as far as even 500 cells. If a person is up to 500 cells, that means they are well controlled and things like that, and their risk, the chance of transmitting to others is less. Now, those who are drugs addict, you understand that when you are in the person within them, even though for us, I mean, I don't know how we can see it, but usually people under who are addicted, their decision making has have some compromise. They tend to involve into risky attitudes. So because they don't care and they tend to involve in risky attitudes, they are at higher risk of developing this infection because the protective method they're supposed to use to prevent them from getting this the infection, they are not observing that. So as a result of it, they tend to be at a higher risk of developing because sometimes they will even practice other factors and things, even with whether the person knows that they don't know as to whether the person have a virus or not, they go on to do whatever they can do. So that's why they are at a higher risk. Thank you. Another question?
Okay, so we
So
continue with the
somebody have a question. On a normal condition, you don't expect your CD4 count except where you have other maybe like immunosuppressive therapy. For instance, if you want to do organ transplant, if you are doing organ transplant, usually they will need to suppress the immune system because it is expected that those ones, the organ is a strange thing that is entering your body. So what happens is that they have to suppress the immune system. So except in that case, on a normal condition, your CD4 count should not actually drop. So somebody say, what is the role of primary healthcare providers in reducing the burden of HIV-related cancers? You need to ensure you do counseling, Your role will be about counseling to ensure that the people who I diagnose start immediately with their ARTs, because when the ART is being taken, they adhere, because taking the ART and adhering to it or complying to it, these are two different things. So you try to, as much as possible, to ensure that the person take the ARTs, they adhere to the timeline, and then they comply to every other thing they need to do. That when they get to know that the medication is about to finish, they need to go back for a refill. So your role now will be counseling, ensuring that immediate treat and there's a test and treat is being implemented. The test and treat protocol is being implemented. Yeah, the ICD-4/8 cells responsible for protecting us from cancer disease. Is HIV virus also cause the reduction in the CD4? Usually the main cells that are of concern for this is the CD4. CD8 have a very, even though they play a role in immunity, but the cell of focus, which are mainly the key defense of the cell of the body, is the CD4 cells. But CD8 also have the function too as immunity, but in different uh, perspective. All right. So Sarah said, in the transmission of the HIV/AIDS virus from mother to fetus, is it only through placenta means or any means through which the mother blood get in contact with the fetus skin? You should don't forget, I told you at three stages. The first is at the intrauterine stage. That's the one you talk about, the placenta. And the second stage is the intrapartum. That's when you are giving birth. So when maybe the fluid comes in contact with the child or the blood gets in contact with the child, that's the next area the infection can take place. And then after delivery, even if you protect everything at that point, and then doing breastfeeding also, you can also come down. You can also be able to transmit to the the child. So they have this method where if and only if you feel that you are not too sure that this person can be able to breastfeed and without infecting the child, then you have to ensure that the complete the feed that is acceptable. You call it the AFAS, the feed that is acceptable, that is feasible, that is affordable, that is sustainable and safe. If they're able to attain these ones, you can divert from, the breastfeeding and to that AFAS. But in a case where that particular AFAS is not met, you can be able to do like breastfeeding, exclusive breastfeeding for the first 6 months. Then afterwards, you can be able to do complementary feed for up to 12 months, like that, or above. So like that. So these are ways. And the next question, again back to Phyllis, is what are strategies for early detection of cervical cancer uh, among women living with HIV? Usually screening. The screening is the main thing. For that is early detection, well, not prevention. And for early detection, you can do screening, and the screening can be either like we saw the pap smear. The pap smear is there. You can also do the human papillomavirus DNA testing. You can also do the visual inspection, which can use either you can use acetic acid or you can use the leucoid iodine. So those ones you can use them to be able to inspect. When you put it on the cervix, there can be specific discolor or coloration that can occur. And that particular coloration that occurs, it will inform you as to whether the person is having or is at risk of developing or in a pre-cancerous state or not. So these are the strategies you can use. Can the cervical cancer be treated, and uh, and care in HIV women? Yes, it can be, especially when the person we go back to the fact that the person is taking the ARTs appropriately and yet their virus low and the CD4 counts are well in place, and then they present at at a stage that is not advanced, because again, cervical cancer, just like the way you see HIV can occur in stages, that's the way cervical cancer can also occur in stages. So it will start from stage one, stage two, up to stage four. But when you see now somebody around stage three and stage four, these are, it can be treated, but not, because maybe the word, the question might have been possibly. You can treat them, but you might not achieve, an outcome that can be able to make the person to be free from the disease. Yeah, so you can treat them once they meet these criteria. But early presentation is the best. Any other question?
There was a hand raised by Mr. Malaysia Jimmy.
I
Please,
think his question, I think he put his question. I think I saw his question, but if you still want to ask, he can ask, but I think I saw his question.
Yeah, that. Thank you so much for your presentation. I'm just kind of concerned with the kind of diseases or all the diseases that are always occurring, and sub-Saharan Africa is the major epicenter. I don't know why it's always happening. You go to tuberculosis, you go to fistula, you go to HIV, you go to almost half of the diseases are occurring. Why sub-Saharan Africa carry the highest? Why? I'm kind of concerned.
Usually, like you see, we spoke about poverty. We talk about the resources, environment you live in, the resources, your availability, I mean the accessibility of healthcare, system, the nature of the healthcare system, the advancement in it. So there is a multifactorial thing. It's multifaceted. So it is not just a pinpoint reason. There might be a lot of them, but usually you tend to see that people of low to middle income country, initially they used to say underdeveloped, but I think they have coined a new word where they say developed and developing countries. So usually countries that are low and middle income countries, like in these areas, are the places you see the occurrence of this kind of condition. Think about somebody who's a drug addict. I mean, addict. Their socioeconomic status is kind of reduced. You know, so because of that, they are higher risk. So same way with poverty, it brings in that also. Because with poverty, almost like you can do almost anything. You can do almost anything. So as a result of that, it increases the risks for these things. Yep. Any order? Okay, moderator, if there is no other question, we're gonna share the
Yeah, yeah.
slides.
there's a
So, sir,
question that
lastly, there's these rumors have been going around concerning a new
Yes.
discovery of the HIV, medication. I don't know how true it is. If you have an idea, can you share with the audience, please?
So, well, I cannot speak to that much because one, my work is not directly involved with HIV, because we as oncology doctors, we have it's a center that deals directly with those with HIV. So, and next thing is that I'm not sure I have come across any publication that speaks about that, or maybe get a news from reliable sources, maybe from the BBC, or maybe CNN or VOA or so, that would say that there have been discovery of a cure, like a cure. If there is it, I have not come across it, so I will not. want to, make any statement, but I have not come across that. If there is any, we might share it in subsequent time. But as it stands to my knowledge, no, I am not aware of that. If there is any, others can share. Sarah, I think he has a question here. He said, in the absence of the antiretroviral drug that are specific to HIV, is it possible to take any antiviral drugs to start managing the HIV in the meantime? Nah, usually, um, like you have acyclovir. Can I help you? Acyclovir, which is used against other conditions, will not help. So the antiretroviral is specific. The reason they say retroviral, it is because of the mechanism by which they use and the particular enzyme and things they use to be able to incorporate themselves into the host DNA. That's why. So the drug being developed against them is as very different as compared to just any other things like that. So you need to go straight for the ARTs.
Okay.
Okay.
There's one more hand raised by Mr. Joseph, and I would like to
Josephus.
welcome him before we close up our meeting. Mr.
Okay.
Joseph, welcome, please.
Josephus. Yeah, Josephus.
Yeah, thank you. Good evening, Dr. Elvis.
Good evening, Josephus.
First, let me just appreciate you for your presentation. It was very educative. But I got a few questions that I want to find out if they apply to my profession. I'm a laboratory
Okay.
personnel,
Mm-hmm.
and
You say laboratory, right?
how late? Yeah, I'm a laboratory personnel with little or at least low level of medicine
You are a
oncology.
health person. Whoever has something to do, you are a health person. Just go on.
Yeah. So I got a few questions. Like at least I got four questions, but
Okay.
maybe we can. Yeah. So the first one, I want to know what laboratory indicators suggest early malignant transformation people living with HIV.
Okay. So that's that. For instance, maybe we can just take maybe the cervical cancer. Let's use the cervical cancer as an example. Um, the pap smear you see there, and then
Yeah.
the human papilloma virus DNA test, and then also the visual inspection test. These are the ones that can be used to assess for early or precancerous or conditions in people with cancers and also with HIV. So once if the person is having HIV and then they go for screening, the abnormality or the specific characteristics that shows when you use these substances during the test or the screening, it will inform the person that there is a precancerous condition or there is none.
Okay. Thank you. So
Mhm.
the next question is: at what CD4 level should the laboratory be more vigilant for AIDS-defining cancers in the lab?
Usually it should be at least the standard is that you should be above 200 cells. You should not be below 200 cells. So when you're below 200 cells, you are at risk of developing opportunistic infections and even the AIDS-defining cancers.
Yeah.
Mhm.
Last, lastly, how does low CD4 counts affect the interpretation of cancer-related findings?
How it affect? Okay,
Yeah,
so like from the beginning we said when 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 onset of the HIV infection, when studies were going on to understand the natural history, that is the natural history will involve how it developed from the very beginning, from the infection stage until maybe even the person died. or a full blown AIDS. Um, it was noted that people who had increased virus load or a lower CD4 count below the threshold or below the expected or the required number, they were more at risk of developing AIDS-defining cancers. So, if a person is assessed, first thing is that they do the determining. The determine tells you that the person is reactive. Maybe the person was not sure. Maybe they go to the bowel or the unigo and things like that, and then go to the Western blot and things. What happened now is that everything is confirmed. Then you will have that the person virus low now, or let's say the CD4 count is less. Once the CD4 count is lower than the 200 cells line, maybe we say 100 cell, 50 cell. I think I've seen a patient who had, I think, 50 or 40 cells, and the person was already having Kaposi sarcoma. I've had few patients. The person had Kaposi sarcoma already, and we did the CD4 count, the person as low as that. So the moment you see a person with that level of cells, already there will be lots of things they'll be having in combination with the cancers. There will be other conditions, but our focus is cancer. So you will most likely see that that person will be at risk of developing a Kaposi, person will be at risk of developing the non-Hodgkin lymphoma, and also the invasive cervical cancer. So yeah, that's the influence of the CD4 count on the uh, the characteristics of the individual.
So lastly, does the immune suppression in in people living with HIV affect the sensitivity of cancer screening test?
No, it does not have any effect on it. It does not, the tests are being tested. They are being designed. They have specificity and sensitivity, and it is unique. So the HIV status does not influence, because these tests are they are specific, so it does not influence the test. For instance, maybe because the person have HIV, so when you go and do test for probably maybe we say parotid gland cancer, or maybe we say uh, maybe um, pancreatic cancer, then the person will be having pancreatic cancer. No, it does not work like that.
All right, thank you.
All right. Thank you too for actively participating.
Okay, thank you so much, Dr. Elvis Davis. We sincerely thank you for your time and for the knowledge you inculcated in us. Thank you, everyone, for your contributions.